Thanks everyone for joining. I'm Jasmine West, she, her pronouns. I'm a manager on NASTAD's hepatitis team. I'm excited to have the hour. I actually don't know how many folks are going to join us, but we have 26 so far, so thank you. We're going to have the hour to talk about HepNET Learning Communities and hopefully gauge interest from all of you about becoming a HepNET member if you're not already, and then also joining one of the learning community cohorts. Next slide. So we will start off with some introductions, an overview of HepNET for those who aren't familiar, the purpose and structure and content of our learning communities, how to apply, and then we are going to open it for all the questions that you might have that we didn't answer in the slides. Next slide. So we'll do a round of introductions. This will be through the chat box. We're going to keep it simple. So if you wouldn't mind, just put in your name, location, if you're part of an organization. All of this is in the chat, but then also what's one word to describe your mood today. So I will get us started off. Again, I'm Jasmine West. I'm in Washington, DC. I'm joining as part of NASTAD. And one word to describe my mood today, I kind of feel funky. And I don't know, like this morning it was like funky fresh. Right now it's kind of just like funky flowy. I see some words coming through between cheery, happy, capable. I'm going to pass it over to Cass for an intro.
Yeah, hi everyone. Welcome. My name is Cass Botts. I use they pronouns or any pronouns that feel good to you. And I am located in Bloomington, Indiana. I am the Coalition and Capacity Building Manager for the National Viral Hepatitis Roundtable, or NVHR. And one word to describe how I'm feeling, I would say inspired right now. And I will pass to my colleague, Robin.
Hi, everyone. Welcome. My name is Robin Lord-Smith. I use she, her pronouns. I am located in the beautiful Blue Ridge Mountains of southwestern portion of Virginia. I work for National Viral Hepatitis Roundtable as the community engagement coordinator, and I will give you excited about this. That's my one word.
Great. Thanks, Cass and Robin. The three of us are tag teaming today. I see intros still coming through the chat. A lot of folks are tired, but you know what? I'm going to call out, who was it here that was just blissful, feeling blissful, Randy. I'm going to channel that energy. So thank you all for sharing. And folks who are frazzled and tired, hopefully you'll be energized from what we have going on today. So we're going to jump right in. If you haven't heard of HepNET, we are the Hepatitis Network for Education and Testing. So NASTAD and our partners, NVHR and NACCHO, we're building a network of public health partners, community-based organizations, tribal health organizations, people with lived experience, healthcare providers, you name it, folks that are involved in harm reduction, hepatitis spaces. We're ultimately building out this network where the impact will be to bridge the gap between hepatitis programs and harm reduction programs, centering health equity and providing the tools and supports to contribute to the elimination of viral hepatitis among people who inject drugs. So I think that this can mean a lot of different things. We do have a one-pager to provide some more context for who we are, how we're structured. I'll include that in the chat box here. But if you're not already a member, it's free to sign up. You can access the link in the chat box. I'll put it in here. If you are already a member, that's awesome. We're happy to have you. But really becoming a member, you're going to receive updates about our project initiatives, how you can become involved, best practices that will directly impact your community in the hepatitis and harm reduction spaces. So I'm going to explain this visual here on the right-hand side. You can see this top loop here. We have training consultants. And currently we have 2 experts with lived experience from North Carolina Survivors Union. Shout out to Nick Boyles and Tina Reynolds. They've developed a 5-module curriculum to implement a training series that serves as a leadership development for a group of consultants with lived experience. This is lived hepatitis and or substance use experience. So then this middle loop here are LLE consultants leading with lived experience. That's the acronym there. So we currently have 3 consultants who are participating in NCSU's training series, and they're building this base of knowledge for skills on viral hepatitis, harm reduction, and leading with their lived experience. So these LLE consultants are then providing technical assistance to jurisdictional learning community cohorts who will request TA through HepNET, and that's that bottom loop there. So you can see how it kind of trickles down the loop. So for example, if you become part of a learning community cohort, then these experts will be a key part of engagement and action planning to strengthen partnerships within your jurisdiction. So when we think about learning communities, we are thinking small scale, large impact. We're going to have a smaller group of targeted jurisdictional teams to improve testing and linkage to care strategies for people who inject drugs, while also sharing out lessons learned with the broader national network. So that's why we have like that network members as the base there, because all of it is trickling out to everybody who's a network member. So learning community members connect with peers, develop and strengthen their connections with different partners, and then they have access to these subject matter experts to explore best practices to, again, address viral hepatitis and injection drug use in their communities. So that was kind of like my, I want to say long-winded, but it was actually a pretty short overview of what we plan to do with our learning community cohorts. These models will carry into additional cohorts, and we'll put them online. They'll be shared with the network, etc. Next slide here. So what is a learning community and the purpose? This is more or less what we just went over, but we are going to dive into a bit more detail, because I think it's important to emphasize how these learning communities are different than maybe some other small groups that you might be a part of. So again, our partnership team between NASTAD, NVHR, and NACCHO, plus our consultants, we're working together to center priority populations and health equity. So we're coming from a place of unifying to improve hepatitis awareness, testing, and linkage to care for people who inject drugs, with specific attention paid to those intersecting identities. And then the multiple ways that PWID, so I'm just going to start saying PWID, people who inject drugs, are marginalized base. This is for their drug use, the race, class, gender identity, age, sexual orientation, and other identity markers. So really this project is focusing on those priority populations with those identity markers, because we're looking to advance community development and those healthcare partnerships that effectively propel health equity. So this is a quick plug that the purpose of the learning communities is stated here, but it's also topic specific. So Cass is going to tell you a little bit more about the topic of this learning community, which is strengthening partnerships. But just for everyone's awareness, there will be future learning community topics that will be tailored to the specific challenges and needs that are identified by the learning community members. So some things that we've already heard from members that could be a potential topic range from project sustainability, culturally responsive education and outreach, addressing stigma among hepatitis service providers. One of them that we're considering is implementing low threshold hepatitis B and hepatitis C testing in priority populations, and then also integrating that testing and linkage to care into primary care, harm reduction, STI clinics, etc. So we're already rolling with some different topics for future learning communities. If this learning community sounds awesome, but you're like, hey, I already have a solid base of partnerships for my viral hepatitis elimination plan, maybe this isn't the one for you, but future learning communities could be. If you're in a space where you're like, oh, what partnerships between viral hepatitis, health department and harm reduction in my community, then stay tuned, because Cass is going to dive more into that.
Yeah, thank you, Jasmine. All right, so I wanted to talk about the learning community structure. And as Jasmine already explained, the first theme is strengthening partnerships, but in future learning communities, there might be more specific themes or topics than that. The learning community is oriented around this particular theme or goal. We say theme because strengthening partnerships isn't necessarily a concrete goal. Concrete goals will be part of the process. But strengthening partnerships between the various organizations that have been mentioned, the various kinds of organizations or entities that have been mentioned, is what we really want to be focusing on for a particular jurisdiction. And when we say jurisdiction, we may be referring to state, but we also are accepting other kinds of jurisdictional definitions. So a county or a city might be able to apply, as long as it kind of, as we'll walk through in the application process, meets what we're looking for out of a learning community cohort of partners. So the cohorts are comprised of these jurisdictional partners who are going to be hopefully representing health departments, community-based and tribal organizations, people with lived and living experience, healthcare providers, and other entities. So what we really want is, everyone who's got a place along the sort of like viral hepatitis continuum of care, everyone who's doing work related to viral hepatitis care and health equity, or who maybe is a community-based organization working with some of the priority populations, not explicitly on viral hepatitis care, but who would be a great partner on the learning community because of the populations that they serve with their whatever particular services they provide. And so the way it'll work is basically we'll have a jurisdictional lead. So, whatever organization is identified as the lead entity will kind of be responsible for the application process. But the lead is also responsible for making sure that all of these representative partners are sort of like pre-assembled as part of the cohort and kind of consenting to being included in the application and participating in the learning communities. So those communities will be hosted virtually, and there'll be monthly sessions that are facilitated by the HepNET partner team. You'll see a lot of Jasmine and I on the meetings, but then also the Leading with Lived Experience consultants will be facilitating that process as well. So if you go to the next slide, Jasmine, I'll go a little bit more into the structure. And so basically, the partner team will review the applications that we receive. And again, we're going to kind of go over that process here in a few slides. And the selected learning community jurisdictions and members are going to work collaboratively over the course of January to May of 2023, and will be developing an action plan as part of the learning community. So these action plans are meant to basically be a document that's kind of a model or a template provided by HepNET that will be, filled out according to your specific jurisdictional needs and the goals that you'll identify as part of learning community curriculum. And so this will again be towards strengthening partnerships in viral hepatitis and harm reduction. And ultimately, as we meet in the learning communities, we'll be doing more than just filling out those action plans. We'll be engaging in group discussions, getting responsive feedback from jurisdictional contexts, and each jurisdiction that is participating in the cohort will learn from each other, right? And then participating in individual and group technical assistance sessions as well. The Leading with Lived Experience consultants are going to be available for some of that more direct TA. And, being able to provide jurisdictional case examples will help us have kind of a responsive curriculum in terms of how the learning communities end up going throughout the course of those 5 months, but also will help each jurisdiction, like I said, to kind of learn from one another. And so, I think a really big piece of this is being able to identify and explore the best practice of viral hepatitis services as it specifically relates to people who inject drugs, because this is a health equity specific project. All right, next slide. So I wanted to give an example. So I'm from Bloomington, Indiana. Some of you may or may not know Nicholas Boyles already. He is one of our training consultants, as Jasmine mentioned. He works with the National Survivors Union, and he also is the executive director of the Indiana Recovery Alliance. So we are located in the same place, geographically speaking. So we're both from Bloomington, where Indiana University is, and we have both been working in harm reduction for a while. So I happen to know the lay of the land with Indiana pretty well, and figured I could give an example of what I could see a learning community looking like for Indiana. And I think, you know, some of the partnerships that we have fostered in Indiana have kind of been similar to what we would be hoping a learning community would be able to put together. So I gave an example of a few different organizations. We've got the Indiana State Department of Health, of course, and we've got the Hoosier Harm Reduction Coalition, which is a statewide coalition that was built around being able to connect each of the different harm reduction players in Indiana and make sure everybody can stay apprised of best practices and receive technical assistance around harm reduction services in the state. And then Indiana Recovery Alliance is a community-based harm reduction organization, and Aspire Indiana Health is a community health organization as well. So, you know, say Indiana assembles this particular cohort as part of the application and says, you know what, our goal is to be able to establish, or if already established, strengthen formal partnerships between public health entities and the hepatitis care providers, which includes the harm reduction services organizations. So that's, again, not a SMART goal, right? It's not a concrete, it's not super measurable in terms of a goal, but that could be like the general starting point for, you know, what these organizations hope to be able to do together. And I think, you know, in the state of Indiana, there has been a decent amount of coalition building around HIV, ending the epidemic, and hepatitis elimination efforts. So you've got the Zero is Possible coalitions in Indiana. And I think the really good thing about that initiative was that they included people with lived experience of HIV and hepatitis from the jump and worked that into really driving their response and elimination planning in Indiana. And so we do want to highlight that, you know, when you're putting together your application, it's really important to identify those key leaders with lived experience or living experience, and really thinking about them as experts who you are, you know, making part of your application process, because, you know, making sure that the people who know what it's like to have lived going through the process of, for example, having had hepatitis and being cured is really important in planning your action plan around how to strengthen these partnerships. And so I think some other examples would be, you know, how to better engage people with lived experience in the elimination planning process, like formally speaking. Building direct and formal partnerships between, say, the community-based organizations that are syringe service providers and the health departments. You know, maybe certain like testing events could be an example of that. Building partnerships between labs and providers and health departments, or, you know, part of the action plan could be explicitly towards starting one of those state coalitions that really, again, formally defines those partnerships and keeping that network together. So those are some examples of things that we see as working well as part of this process, or hopefully coming out of this process. Next slide, Jasmine. So we also wanted to make sure before the Q&A session piece of this webinar that you would be able to get a visual of the application if you haven't already. So, you know, the applications are now live and we are accepting applications. And first we ask that whoever is identified as the jurisdictional lead organization, if you complete the application, or if you intend to be completing the application on behalf of your cohort, then please submit a letter of intent by November 14th. And this is really brief. I'll go ahead and screen share in a second, and you can see what this letter of intent might look like and what we're asking. But basically, we just want to make sure that multiple entities in a jurisdiction don't kind of have like duplicate efforts, right? If multiple entities are trying to apply for ultimately what's going to be the same cohort, it can save time if we just go ahead and figure out who plans to apply in advance with a very brief letter of intent, and then coordinate those efforts and connect whoever needs to be connected to make sure that it's just one application per jurisdiction. And then you'll want to just obtain consent from all of the partners that you're identifying in the application process. So this can be individuals and organizations. And then I'll walk you through the application in a second, but you'll just give some kind of basic background to help us in reviewing the application and ultimately selecting 3 to 5 jurisdictions to make up the cohort. So I will share my screen now and we can go ahead and look at that application. Okay, so first you're going to see this is our letter of intent. As you can see, it is very, very brief. We are just asking that you state that your letter of intent is to inform us that you're interested in applying, and just give us a little bit about, what your role is, what organization you're with, what jurisdiction you're applying for, why you want to join, and which partnerships you would hope to strengthen as a part of your participation in the learning community. So that's super brief. And that's all we're asking, just so we can get our finger on the pulse of who's intending to apply. And then I'll go ahead and also walk us through the application itself. So this is a Qualtrics survey format. So what you've got is your page 1, just kind of gives your instructions with the relevant dates and deadlines that you need to be aware of. It also has our contact information, mine and Jasmine's, in case you need to send us any questions that you didn't think of today or that come up as you go through the process. And it gives some background of just kind of why HepNET was created, what we want the Strengthening Partnerships Learning Community to do, and some information about like when the learning community will take place. So I'll go ahead and just show you just some of the pages so you can just have a visual idea of what you're going to be looking at for applying. But you've got your general contact information for the lead organization. Again, this will be the one entity that's applying as the application lead. And then we've got here, you're going to name your jurisdiction for us. And then we want you to identify the key partners that are required or recommended. So we've got, you want clinical partners, you want FQHC, health center, health systems. We want the state health department for a state jurisdictional application to be identified, as well as a local health department. And we also really want to stress the importance of inclusion of the tribal health departments or tribal organizations in your jurisdiction where applicable. We know that not necessarily every jurisdiction is going to have the same level of representation or entities available for these partnerships, but part of health equity is honoring and recognizing the role that settler colonialism plays in the inequities in our systems. And so we really, we have an idea of which tribal health departments and organizations are in which jurisdictions. So we really are going to be looking out for, if your jurisdiction has those organizations, that inclusion in your application as well. And similarly, you want CBOs that are providing harm reduction and behavioral health services, but also, because of this health equity focus on priority populations, we also want identified CBOs that are primarily serving Black, Indigenous, and people of color. And then a person with lived experience of hepatitis and or drug use, and then some other options for maybe not required, but recommended agencies. If you think of anybody else that would be a non-traditional partner, we do have an other section as well. And there are some examples given of non-traditional partners that we would recommend in the application. So once you do that, you confirm that you got consent from all of those entities that you're naming, and that they're on board with, ultimately participating in the learning community. And then we've got just our kind of narrative. So those are all of the sections of the application. We try to keep it brief while still getting a good idea of what you've got going on in your jurisdiction. And we will ask for a statement of support by the lead organization's authorizing official only. And I will go ahead and share, I think now, my next slides in the PowerPoint. So we've walked through the application process now, and I'm going to pass it over to Jasmine, who's going to talk about the selection criteria.
Great, thanks for that, Cass. So I think when we look at it real time, you might be like, oh my gosh, another application. But to Cass's point, we did try to make this a light lift. We are asking a lot of questions, but just a few sentences speaking to what you will get out of the learning community. Cass, should I share slides? I still see the application.
Oh, that's my bad. I think I need to reshare the screen then. All right, do you see those now?
Yes, thank you.
Okay.
So again, once the applications come through, our partner team will review and select learning community members based off of a few things. So here we have jurisdictional characteristics, health equity focused, harm reductionist, goal and impact for strengthening partnerships, and the value you gain from participating in a learning community. So in your application, we want you to be honest. You don't have to lie about something just because you don't have that connection. But I think there's a lot to say, when you are honest and you're explaining like, well, this is the partnership that I want. So this is how a learning community could benefit me. So you will have the opportunity to elaborate on things that are key in the selection process, right? What is the current state of viral hepatitis for PWID in your jurisdiction? What are some of the barriers for your priority populations? And is your jurisdiction committed to bridging those barriers and addressing those inequities? So through your application, we're going to learn more about your current state of your partnerships, how your jurisdiction could benefit from this TA, looking at your current landscape and the capacity to implement and sustain the action plan that is ultimately derived through this 5-month learning community cohort. So we do have time for all your questions. And I think before we just jump into the live FAQ, I want to mention that there will be a living Q&A document. So, if somebody hops off this webinar and they're like, oh, I forgot to ask that, email us, and then we're going to respond directly, but also provide that question answer to a live FAQ Google Doc. So that way, anyone that has the questions throughout the application process, this form is available to everyone to see the questions come through. So those will be updated as we receive the questions. And I'm going to actually put that in the chat box so you can see what we currently have. It's the questions that were already answered, what is a learning community, purpose, timeline, etc. But if we have questions specific to the application process or whatever you all might have, we'll include that in the living document.